What is going on, guys? Before today's vlog, I wanted to talk about something really serious, and that is medical student and physician depression and suicide. This is actually a lot more common than the general public may think. What really motivated me to talk about this was the 3 residents recently committed suicide within the past 7 months at this program. Now, this program is not the only program to deal with this. There are multiple programs, there are multiple schools who have had residents and medical students commit suicide. And my program does a very good job of explaining to their students about mental health and the resources we have available, but not every medical school is like that. And I can't really say what is going on in residency programs that is causing this. Like I said, I'm only a second-year medical student and I haven't been in the shoes of a resident, so I don't know what residencies can change to solve this problem. But what I do know is that 3 suicides within the span of 7 months is honestly heartbreaking, especially as a medical student who's going to be applying to residency within the next couple years. That's just something you really don't want to hear as an incoming resident. And I don't know what the solution is, but the only way we can come up with a solution is to talk about it. Bring awareness to the subject, and that's what I wanted to do today, is just bring awareness and talk about medical student and physician suicide. And I've actually linked 2 videos down below, one by Dr. Kevin Jabal and a TED Talk done by Dr. Pamela Weibel, just to kind of educate you guys on how prevalent this is and how big of an issue this is within the medical profession. And along with me talking about it, if you are a medical student or a doctor or just anyone who wants to talk about depression and suicide, please make a video about it, please make a post about it, or even drop a comment down below talking about your experiences and help bring awareness to medical student and physician suicide. And even though I personally don't know what the solution is to this problem, I have dropped a couple links down below to help anyone who is feeling depressed or who is feeling suicidal. And I want you guys to know that this channel is a community. We're all going through tough times together, and we're all here to support each other and lift each other up. I just want you guys to know that you're not going through this alone, and if we can voice our opinions and bring awareness to the topic, then we'll make a better medical profession for medical students and physicians to come. So thank you guys so much for listening in, and I hope you guys enjoy the rest of the vlog. What's going on, guys? For those of you who are new to the channel, my name's Ethan, and today I'm not only going to be taking you through a day in my life, but a day in the life of Dr. Antonio Webb. So if you guys don't know who Dr. Webb is, not only is he a combat veteran, but he is an orthopedic surgery resident. So I thought it'd be really cool to not only give you guys an insight into my life, but an insight to the day in the life of an orthopedic surgery resident. So I hope you guys enjoyed today's collaboration between me and Dr. Webb, and I'm gonna hand it off to Dr. Webb so he can tell you guys a little bit more about himself.
What's up, everyone? This is Dr. Webb here. I'm an orthopedic surgeon out in San Antonio, Texas, coming up on my 5th year of residency. Today, you're gonna be following me around as a orthopedic surgeon. Today, we have a few cases. We have lecture, as well as we're doing a cadaver lab where we go into the lab and we practice basically surgery and how to do the cases. EJ Fitness, thank you for the opportunity. Here we go. So my days usually start around 5:30, 6 o'clock in the morning, depending on how many surgeries we have to do, and also depending on how many patients I have to see. So before surgery, if surgery starts at 7 a.m. and I have 6 or 7 patients in the hospital, I need to go see those patients before surgery starts, because as the day gets busy, I may not have time to go see those patients. You do rotations. Shoulder and elbow is one I'm on now, so it can be shoulder replacements, rotator cuff tears, it can be labral tears, slap tears, carpal tunnel release. We do all those procedures in this 2-month rotation. Rotation here is kind of middle of the road, not as busy, so it allows me to do some research. You have a research requirement as a resident also. The typical day, I usually come home from work and then try to get some study in it. In residency, you still have to study. We still have exams, we still have lectures that we go to, but every year we have a resident exam. It's called an in-service exam. It's an 8-hour exam and it tests your knowledge of orthopedics. You still have to come home and study, and I try to study for at least 2 hours a day. Sometimes that's a stretch, but I at least try to get that. All right, let's check in with EJ and see what he has going on.
I hope you guys enjoyed that segment with Dr. Webb. My morning was pretty uneventful. I woke up, I grabbed some coffee, I ate some breakfast, and now I'm going over some reproductive pharmacology. So what I'm doing is I have my lecture notes open on OneNote right here, and then I'm going over the same drugs in first aid. And basically what I'm gonna do is just highlight and fill in any other missing information that's not in first aid that's in my lecture notes. It's about 11:30 right now, and I'm following up with a standardized patient at school later today at 2 o'clock. So I'm gonna go ahead and get ready for that right now. It's always hard going to class when you gotta go and leave your dog and she's looking super cute with her toy. Penelope, I'll be back soon. All right guys, I'm all ready to go. I have to be at class in about 2 hours. I'm gonna meet with my classmates and kind of discuss our diagnosis and all that stuff. So basically our case was we had a 45-year-old female come in with pelvic pain. I'm not really going to go into more detail than that. And we think it's either one of two possibilities, so we have to discuss that and see if we can come up with a definitive answer. So yeah, gonna go follow up with that standardized patient, and here's what Dr. Webb is doing.
So I just got to the hospital. I'm about to go see patients. It's called rounding. We round on our patients, and then I'll head to surgery here in a second. So the first case that we have today is a lady who has an infection in her elbow. She had an elbow replacement, which means that the parts of her bone that were arthritic were cut out and then replaced with some metal parts. Well, it got infected. Today we're gonna go in and remove those infected parts of the bone. So we're gonna use a cadaver to replace that bone that's missing. Cadaver bone. It's called an allograft procedure. Surgery should take about 3 to 4 hours, and we're about to get started here soon. Bone from a cadaver. We're going to use this to reconstruct the humerus. You see, this is the bone here. We're going to cut it so it actually fits inside the patient's bone. So I'm just leaving the operating room. The surgery went well. Now I am heading to a lecture. We have a lecture today by our staff that can be anywhere between 1 to 2 hours, and then we have cadaver lab after that. So pretty busy day. Stay tuned.
All right guys, we both just got back from class. I finished. So our team got our diagnosis correct for our patient. Madison had clinicals today at, is it still adult?
Yeah.
The adult floor, adult healthcare? She's working on the adult healthcare right now. And so yeah, we're just kind of hanging out, and then we're gonna go get a workout later. And then we'll probably eat some dinner and then unfortunately do some studying. All right guys, so it's about workout time. So that means I'm gonna be taking my Ghost pre-workout right here. And then we also have our new creatine here, the sour watermelon warhead flavor for the creatine. But yeah, we're gonna go work out. I'm gonna be doing a back and arms workout. Madison's gonna be doing some legs. She's gonna be doing some glutes. I'll show you guys a little bit of that workout here.
I woke up in
What's up everyone? We go in the lab and we practice surgeries on the cadavers. And the best cadavers are the fresh cadavers because all of their skin, all of their soft tissues are more like a real person. Today we're gonna practice doing total knee replacements and total hip replacements. And that's basically going in and cutting the damaged or parts of your knee that are worn out and replace it with metal parts. This is how we learn, this is how we practice as to become a surgeon. This is what it requires. You need to practice, you gotta put in the time, you gotta put in the hours if you want to be a great surgeon. So this is how we do it. Here we go. I just got back home from work. Busy day today, but had a lot of fun. It's about 6:30 p.m. When I get home, I have to study. So I'm gonna try to get some study in today, and also I may try to go to the gym for a little bit. But thank you again to EJ Fitness. It was a lot of fun hanging out with you guys. If you guys have any questions, you can always email me at overcomingtheoddsbook@gmail.com or contact me on my website, AntonioWebbMD.com. We'll see you next time.
All right guys, I hope you guys enjoyed that collaboration with Dr. Webb. It was a real pleasure having him on the channel today. Be sure to check out his channel. I'll post it in the description below. Now I'm back from the gym, just watching some lectures from earlier today, but that's gonna pretty much wrap up today's video. I hope you guys enjoyed it. Comment down below what you guys wanna see next. I'll see you guys next time.